The answer to language is to think about language and to interrogate our language and to contest it and to see the relationship between the words we use and the reality we create.
Welcome to Back to the Future podcast. My name is Victor Sadia, and I talk with brilliant minds and hearts of people who want to uproot and transform the current health and wellness paradigm. Good morning, good afternoon, good evening. Today we have Cheryl Heller. Cheryl Heller founded the first MFA program in social design at the School of Visual Arts. She is president of the Measure Lab and founder of the design lab CommonWise. She received the AIGA Lifetime Medal and is also a Rockefeller Bellagio Fellow. Her book, The Intergalactic Design Guide, is a manual for anyone wanting to use design to create a resilient future. Cheryl, thank you so much for being here.
I am really happy to be here, Victor. Thank you.
So we were just talking about boundaries and language and how healing is something that we cannot think anymore as a specific area. Basically, it's pervasive in all systems, culture, society, ecology, economics. How are you thinking about healing and health in these times?
Very big question. I think we are at a moment when everything affects our health. When stress from COVID, whether we got sick, had people who got sick, stress from the political situation, certainly in the United States. I don't speak for Mexico. Grief for the environment, grief for civil society, all have an enormous effect on our health. And so I think that these are all threads. And so we need to look at all of them together when we think about health and we think about healing.
Personally, I like working in this, I call it industry, but it's much more than that, is that whatever you do, think, or plan in terms of being a parent, being a professional, being whichever role you pick in the society you take part on, you are really talking about health and expanding human potential and being self-aware of what you are and how the world around you is both influencing you and you are influencing it in a co-creating machine. In this sense, how can we expand the term of health so that we all begin understanding that health is not just a detail or just a specific thing that we can have in a box, but rather everything that we do has to do with health and healing?
There is an idea that I love that is very much a part of my work, and it's at the heart of any social design, and that is the notion of conditions for success. That we don't look for single answers. We don't look for quick fixes because they don't exist. We look to create conditions for success. And I think that conversations and real attention and intention to what are the conditions for success for all living things to thrive on this planet, and how do we go about doing that? So if we think about it that way, it includes all the things we would need to thrive.
Obviously, that presents an epistemological difficulty, which is how can we work with everything at the same time? And it requires us much more of the complex thought that we have achieved as a community. Like it's really getting into the generalized view as well as the specific at the same time, like taking into account every moving piece at the same time. I guess that design is a way of managing this complexity. And you were telling me that you were kind of frustrated about how there are no more boundaries anymore. How can we use some boundaries, but at the same time know that those boundaries are arbitrary and that we should also play with them for a while and then change the boundaries for others?
I'm sorry if I said that I am frustrated by a lack of boundaries, because I love that life is porous. I love that our cells are exchanged with other beings. I love thinking that trees know when we're there as well as we know with trees, and the trees are all connected. So, and there's a wonderful book called The Place Where You Go to Listen by a man named John Luther Adams, who created a museum of sound that the earth creates, in case you know it. But he talks about how boundaries and borders are where the most interesting things happen, right? It's at the edge of a field, it's at the seashore, it's where one thing transitions to another. So, but I think your earlier point is related to this, in that we don't work on everything at once and we don't do everything. We just imagine the conditions for success or the desired end state. And then we analyze what can we work on and what is connected to another thing, knowing that they're always dynamic. And first of all, this is all moot because who's the we? You and I are having a lovely conversation, but many more we have to be involved in this. So it isn't that we don't have to do everything at once, and we can't do everything at once, and we won't get everything right. But at least we will aim for a future state that looks at the whole Earth, the whole species, the whole enchilada, whatever. And then you said something else that I wanted to talk about. Yeah, just I don't think design for me is a way to apply the creative process with control, with intention, with rigor toward an intended an intended outcome, right? And so in that, it applies everywhere. There's no place where the creative process isn't important, but it's not the solution to everything. It is a process, right? So I got involved in education because I thought there was a big gap in that designers were being taught that design is the thing, that it's the end. And it's not, it's just a process. But it's a really valuable process that helps people think, if not in completely different ways, then in additional ways about how to conceive of ways to live, ways to be, ways to address issues.
There's this parallelism with design and I guess our own health, our own personal individual health, and even the societies, which is probably focused much more on process than the goal. And in this sense, I guess that I usually define the conversation that you just referred to as health. If we can continue talking and really engaging in something that we don't fully understand, but by being in the conversation, we are fully present, fully aware, and fully trying to create a multidisciplinary, multidimensional conversation, then something is happening towards health. The question, I guess, would be how can we talk the same language? You are now working on your dissertation where you talk about language and, in a sense, how the languages traps us, but at the same time, it enables many things. How to think about language in this sense?
It's such a big subject. I think just as you said, this conversation is about health. The answer to language is to think about language and to interrogate our language and to contest it and to see the relationship between the words we use and the reality we create. One of the things I'm looking at in my dissertation, beyond where do the words come from, right? Who gets to say what words we use? Well, organizations and people with money get to say what words we use. If you're a funder and you say, hey, this is what we should be doing, or you go, yeah, you're right. Can I have some of your money? And I'll do that. And experts, right, get to decide what language we use. But we accept that, and it becomes common sense in the sense that, and it's called interpolation, when people accept their place in a hierarchy, right? Or they accept an ideology as it positions them. So simply questioning that is kind of the beginning and the most important part. It's being aware of the words we use. So most people who are going to, and it could be medical labs, right? It could be doctors, like, I am going to help the sick, or in the social sector, I'm going to end poverty, or I'm going to end malaria. Now you know who I'm talking about. And it positions all of the agency and all of the power with the actor with resources and none of the power. It doesn't recognize an ecosystem with distributed agency, which is what we need.
You've quoted Lance Lindblom when he said that social change is the redistribution of wealth and power, and that is why it's so hard to change. At the same time, like if you're inviting everyone to the conversation and by just asking them questions and by just asking them to show that they have agency in a sense, you are already empowering them in terms of health. How do you think this has changed in the past 10 to 20 years in the health industry, and how is the industry more open to give agency to other players, stakeholders, and at the same time, how is the discussion with design evolved as a co-design process in a sense?
There's been an enormous awakening, sort of, to the end user, to the patient, to the individual, right? So, in a sense, that is parallel with the recognition of user centered efforts across the board. And I think we owe a lot of it to technology, right? When user centered, when the web was in its infancy, was a revelation. And so there are different places where this is coming up. One aspect is that healthcare has become so complex that people have to take responsibility for their own health. And therefore, they need to know enough to make the right decisions, and they need to have the wherewithal to act. Add to that the shift from clinical health to the cultural determinants of health, when we recognize all of these other dynamics that affect people's health, that it's way beyond the purview of a physician or a company in healthcare to affect all those things. And so that again resides with the individual. And another dynamic is if you read what, for example, the Gates Foundation says about a human-centered approach, the last 20% of the people are those that are most difficult to help, either because it's difficult to reach them or difficult to understand them or whatever it is. So they view a human-centered approach as the only way to understand and to support that last 20% of the people. So all these things are converging and have changed healthcare dramatically. But I don't need to tell you that.
So I was thinking about this parallelism of just taking the first part of your answer when you said that individuals must take some part of the responsibility for their own health. If we see also on the larger context, the society, the collective, as taking responsibility for what we are doing and not doing with our planet, with our as a species, then we start seeing that the narrative of health where disease is imposed or it's invading you via germs or via whatever that's attacking you with this narrative of war and invasion, and as if disease is something that it's separate from us. How do you see this narrative being built in the way that both the individual and the society is looking itself in the mirror and taking responsibility for what we've done as a species with the planet and with pharmaceutical interventions and all that? Probably the last example wasn't the best. I'd say, how are we looking ourselves in the mirror, knowing that diseases are also created by the systems that we created, economical, political, and so on?
Well, I can tell you what I hope will happen and what I think needs to happen. I don't know if it's the narrative that addresses everything. I was really struck in the project we were doing with Centro when Dr. Marilu said, because I can't remember if you were there. I was speaking to her about the language used in medicine. And she said the same thing, right? The current language prevents health because it's all about health coming from the outside of a person rather than the inside, right? She said it's inside out. And so the arc of we had these big institutions and power centers deciding what was right for everybody. Now we wake up and we realize that it doesn't work, and you need to include the people that you are trying to serve or sell or support, whatever it is. And then an evolution of that can be, well, instead of someone giving you agency, that you realize that you have it, right? And you realize that all of this has to come from the inside. All of this is a decision about how we live. The challenge for that is that because of the gross gap in economic access, in access to health, it's unrealistic to think that everyone has any control. In the United States, it's abhorrent fact that bad food is cheaper. And if you have no money, you end up eating the poison that American food companies make.
I think you touch on a point that it's very, I find it like a bottleneck in terms of when we plan for the new businesses or the new ways of organizing society towards health. Just specific this point, how are we paying for that when the thing that gives us disease or that manages disease are profit making machines, but they need disease both for creating with, like you said, cheap food, but also by giving you drugs that will manage the chronic condition for a long period of time without really curing it. How are businesses, innovative businesses in health, how they are getting to this point of how to monetize profitable businesses when you want to empower your client, when you want to give him agency, when you want, in a sense, to give him freedom from your own product or your own services, not having him or her to having to buy your product or service so that he's happy and he's well, but instead giving him the tools for that his own well-being can be self-directed.
There is a spectrum that exists, I think, in everything that you mentioned. So I don't think we will ever have a world without disease, or that the need for clinical health will go away. And I think the agency that we're talking about and the ability to choose health on the part of individuals will grow. And in terms of offering someone health and not having a business, so there's do you know Equalize Health out of
No.
San Francisco? Really extraordinary company run by a woman named Krista Donaldson. She is an engineer and a designer, and they developed a product that cures infant, not anemia. Hang on, I have to look it up. And they are a for-profit company. Jaundice, it cures jaundice. It's just it's a light, but it's a light that didn't exist anywhere. And their aim is to make this available to doctors and hospitals everywhere. And they have extraordinary data on how many lives they've saved. They have a really impressive design approach to doing this. They continually iterate. They are out in the field doing research with how the product is being used, what needs to change about it. They've gone through multiple versions of it that address feedback from the field. And so to me, that's an example of an extraordinary company that, companies need to be sustainable. There is no way to survive unless you have a model that is sustainable. There, on the other end of the spectrum, there's information, there's awareness, there are services that have a very different model and a very different relationship to people, are in a different category way on the other end. So I think all of those things need to live there. I sense that what you're asking about are what I think of as the remnants of the industrial age and the remnants of, not remnants, and the product of neoliberal institutions, which is our job is to return value to our shareholders and our job is to grow regardless. And that, I think, is a limitation that we're paying a huge price for. Maybe the biggest cause of the inequity and the destruction that we're seeing all around us.
How do you see, because you've been working with dozens of companies who are really putting, I guess, three bottom lines instead of the money one, namely the social and the environmental as part of their DNA, I guess, not only their goals. How are they being successful? I guess that in terms of PR, they get a lot of PR, but in terms of changing the paradigm of how to think of on the roles of companies in these modern times.
How are they succeeding?
Yes, in because they are not only, if we measure them only by the profit they're making or the PR they're getting or the sustainability efforts that they are achieving, I know they're doing well. But how are they contributing to changing the paradigm of how we see the role of the company?
Again, it's a continuum, right? It's not possible to generalize. So on the big capitalism end of things, I'm not sure if you know who Larry Fink is. He is the chairman of BlackRock. BlackRock is a financial management company that is so enormous that they manage the finance of entire countries. And he is one of the most powerful people in the capitalist world, which I guess is our world. I mean, I'm I don't mean that I'm not a part of it, but I guess that is the pervasive model. And he writes an annual letter, and for the past 3 years has become more and more direct and specific about the fact that it is no longer enough for companies to deliver financial value alone. And he has said that BlackRock will evaluate their investments with multiple criteria. And they have done that. And every year he sort of calls out all these other CEOs. So that's having an effect on that big, multinational scale. You have companies that have really taken seriously their responsibility. One of the most well known is Interface Carpet, that had a remarkable CEO in Ray Anderson and demonstrated that a business in one of the most toxic industries ever can change. And so there are examples of companies that have innovated and grown very directly because they are thinking about things in a different way and taking greater responsibility for the health of the planet, for the health of the society, and their own health. And so there are lots of examples, and I do think it's changing. And I think, what we are seeing is more and more companies who are understanding as people demand, as the media pays attention. So I do think that's happening. The question is, as with climate change, is it happening enough and quickly? Yeah. So, and then on the other end of the continuum are companies that start out to represent all of that. Companies like Ecovative that develop the technology that grows replacements for plastic from mushrooms. I was going to say this earlier, but this notion of triple bottom line is false, right? There's only one bottom line. The notion of a bottom line is there's only one. So we complicate things and we give excuses, so it's okay if you mostly make money, but you do a little bit for it's not, it doesn't count. It's the cost is the cost, the destruction is the destruction, the contribution is the contribution.
Yeah, and I agree that the triple bottom line is just using it's trying to use a way of organizing as a metaphor for something else that it's still emerging. As a bridge, it can work towards a new language, but not as the final goal to just quantify the triple bottom line. In that sense, I think here narratives are important in allowing us to see, and in this point we began this conversation, which is everything is connected. And our agency depends on that connection and not really isolating players and stakeholders. In this sense, I think design is doing a good job because they're putting in the same room people from many backgrounds, many disciplines, and they are at least coming together to discuss complex ideas. How do you see that complex thinking and systems thinking might evolve in the educational arena? And then I'll ask you on the health arena.
You're asking very big questions, Victor. In both of those arenas, change is really difficult because there's such entrenched structures and ways of thinking. I am involved in transdisciplinary programs now. The point of my role at ASU is to bring together the engineering school, the business school, and the design school to overcome the silos that have been calcified by so many years of separation. And it is the future. I believe it is the future. I don't believe it's for everyone, but the world outside in nature does not distinguish between engineering, business, and design, right? Those aren't real. Those are human inventions. And if you talk to employers, they want people who are broad thinkers, cross-disciplinary problem solvers, T-shape, whatever people call it. And so I do think that is the future, and that there are more and more examples of institutions and outside and non-institutions who are paying attention to that. I think companies are trying to educate their employees in that way, and universities are trying to address the need. In healthcare, same kind of calcified expertise. And I can speak for academia that there is stubbornness and resistance to change, which I think exists in healthcare perhaps even more because there are lives at stake. And transdisciplinary thinking, diverse thinking, is experimental. The whole point of design is that we don't know. We don't know the answer yet. And that is so antithetical to the bureaucrat, to the manager, not to the scientist, but to the expert, physician. It strikes me that people coming together and reimagining something as a whole is hard, but exciting when you have people who are committed to doing it. And that part of it is very creative. The part that catches one off guard is all of the systems that get in the way, faculty pay, scheduling, ways of doing business, the credits for courses, the credits for students, it's like a million little systems, little bits of bureaucracy that keep us frozen in the same place. And so, the getting together and talking about it and working really hard to get out of one's own mindset and understand others is great. And the rest of it just catches you off guard. And there's an expression of being pecked to death by ducks. It's just like every day, three little, can't do this, you shouldn't have done that, you should have known that. Here's the paper you actually needed.
That's something that's been on my mind a lot, which is if we can really ask for academia to rebuild itself so that interdisciplinary thinking, it's not even the word makes the point that the disciplines are separate and we're bringing them together. But the world is not broken into here's business and here's design and here's engineering, although the way the epistemological approach is always to go that way. So I'm curious as if you know any other academic university or even experiment where we are not trying to bring together departments, but rather just try to build programs that are transdisciplinary, because for lack of a better word, but from a unified perspective.
Yes, there are programs that sort of do it outside. There's the expression skunk works, and I forget where it comes from, but it's an interesting within big companies, right? How do you protect innovation? How do you give it a space where it can happen and it has the ability to experiment and make mistakes and be interdisciplinary? And what I see in education is a little bit like that. There are non-degree granting programs, then there are little labs and things within big universities. Labs are a good way. Well, what's the difficult place to do it is in the traditional degree granting academic part of it, right? So, at ASU, there's three big parts to the school now. One is the academic, one is research, and the other one is all non-degree programs. So high school kids are looking at grade school kids. All of those other places, it's so much easier to ignore the boundaries and break the lines.
As if the lines, it's not only that you are ignoring them, but probably trying to think that there are no lines at all. And you were telling me that in healthcare, this stubbornness to change, also to build interdisciplinary work, comes from the notion that lives are at stake. So we cannot play with them, we cannot experiment with them. And in a sense, I see that lives are already at stake because of a lack of good healthcare in a way. And this comes back to the academia, where lives, or at least the survival of the own institution, as the way it has been working forever, it's also at stake in their heads. So it seems to me that interdisciplinary work and building these kinds of experiments in terms of design in academia and in healthcare needs this jump into the abyss. This needs, the risk will be part of the next thing that comes in, and we need to build awareness that this risk is part of the equation, which I'm not sure that everyone gets.
I agree. Not everyone gets it. And some people, some people think they're not risking big things when they actually are, which I think is what you're saying. And when the risk is early, it actually is a safer way to go, right? When the risk is before, in the early stages, when you're just trying things out. And the other, I had a conversation with a wonderful woman who founded a nonprofit. I think I talked to you about it, Equalize Health. Her name is Krista Donaldson. And she was saying this idea of iteration, which the technology industry people, well, of course, they're going to be bugs in apples first, you know, whatever. And of course, it'll keep getting better. But in healthcare, people insist that there's a way to get it right the first time. And then you can't be wrong. You can't be wrong.
That's a huge thing. That's really a huge thing. And, because lives are at stake, it's that we need to know that we won't get it right the first time. It's not the other way around.
Right.
So you've described design as the best way to get from A to B when you don't know what B is. I would love to hear you about more about this, and I'll give you my point of view on that very beautiful phrase.
Well, I said that a long time ago, and actually, I would change it now.
Okay.
I would change it to you don't know where B is. Because I think actually design is about imagining a desired future state and not having any idea how you're going to get there, but never giving up. I wrote that for a piece for the AIGA many years ago, and it doesn't hold up because if you think about what that means when you don't know what B is, right? It's actually the kind of design I don't approve of, which is, well, let me just start designing. I'm cool. I'm really talented. This will be fine.
Yeah, and I love the way you say that, it's a state where you want to get to. It's not definitely a place, but a state. And I think that's something that in health is really important. That what's the state you want to live in? And we'll figure out how to get to that state. And in a sense, it's always changing. That B point is always changing. So empowering the entity to get to someplace else, just to simplify, you're focusing on the journey. You're focusing on the tools that you have to get to whatever place that you are getting, and then you can change it. And I think that's also important, that we can move those potential objectives.
Yes, and I learned from Paul Polak that if you imagine what you want to create in a big enough way, it doesn't change. He wanted to help people earn their way out of poverty, and he focused on farmers who make $2 a day or less. And he did it in some cases by selling them treadle pumps to bring up water during the dry season. He did it in some cases by starting clean water, purified water delivery companies. He did it in other cases by figuring out a way to burn mesquite, which is invasive. So he kind of didn't care how he did it, but he never lost sight of that goal.
Yeah. Another thing that I wanted to talk with you is about the role of the generalist and the specialist. You pointed out that generalists have less sex, and,
I
and that
don't.
you,
I didn't have any data on that.
yeah, but probably that intuition is correct. Uh, and that you get hives just thinking about narrow areas of expertise.
Oh yeah.
So, how can we continue legitimizing this important role of the generalist? How can we think of a better word for generalist? And how can we reconcile the need for both specialists and generalists?
One of my students in the second year of the graduate program said to me, is he'd been out at a meeting, and I think he'd been at a meeting with lots of experts. There were scientists and data people and business people. And he said, what am I expert at? And I said, you're expert at the process that brings all these people together and helps them figure out how to work together. So I think the way to avoid that label, which has baggage, is to talk about, being expert at a process and being expert at creating change. There's lots of things we do, but like Paul Pollock, we can do them in a lot of different places, right? The end result is the same and the goal is the same.
You are a highly self-narrated person, in the sense that you've been writing for a lot of a long time, and in a sense, I guess that you have a a good level of self-awareness and personal story, and you don't tend to hide. Well, we all hide in a sense, but you tend to open and say where you are. So if that's not a very personal question, what is your personal narrative today, June 28th, 2021? What's the next, or what's the story now?
The story now is that I don't want to waste time anymore. That I know in my life I've spent a long time learning to do things, and I'm not finished by any means, but I it's time to focus on the places where I can really have an impact and not on bullshit.
Can you tell us about that bullshit?
Oh, do you know that book? There's a wonderful book professor at Princeton called On Bullshit.
No, I'm not familiar with it.
Oh, it's wonderful. His name is Frank something. I'll find it. You know, there's so many different kinds of nonsense going on, right? Nonsense in, in this country that people don't want to admit that this is a racist country. And so you can't ever solve a problem if people don't admit to having it. And I think, how sometimes you feel like you're in a river and you're flowing with things and you're just where you need to be. I think that's something we do for ourselves. And my narrative right now is that I want to do that. And I need to be free of other things in order to do that. When I went back to school to get a degree in creative writing, and my advisor, a man named Kenny Freeze, he looked at me and he said, "Oh, you're old. That's great. You'll have a life to write about and everything." He said, "I'm sick of 21-year-olds writing their memoirs."
Yeah, and I think that when you say bullshit, when you have the experience that you have had in many realms, then that bullshit, it's not that the other things that people say that it's bullshit, it's not bullshit. But when you have enough experience and you have walked many paths, then the bullshit, in a sense, it's, I guess, a bit more real. And I guess that the process of design is basically defining what bullshit is and choosing not to focus much more on that and trying to invent new shit.
Well, I think a lot of designers are full of shit. I think designers are capable of deluding themselves that design is an end product instead of just a way to do things that are either worthwhile or not, either destructive or not, either important or not. And it does take living for a while to see what in your life has added up to something, what has been not worth the effort, and what's really mattered, and I look back at still, every day there's an email from an alumni, a student of mine, and that's pretty good, that's okay. And then there's other stuff that just that happened, right? And listen, I mean, you can't, nobody gets to only work on important meaningful things, but
How do you plan to calibrate from now on the need to listen and the need also to be heard? By taking a course with you, I was amazed by your ability to listen and to really be patient and really hold, because I know that your mind is full of ideas, but at the same time you took your time to think, to listen, and to be present. And the 2 or 3 times that we have spoken over the phone, it's the same. I really get that from you, which I'm not sure that you've always been this way, especially living in Boston and New York, where everyone wants to, just talk and talk. But from now on, and when you're thinking about not taking more bullshit, how will you balance this listening and talking?
I only talk when I have to. I'd much rather listen. Someone who knows me well called me a failed introvert, and it's true. I'm happier writing than I am talking, and listening is. And again, not everyone is interesting. I don't. I'm very careful. I choose my moments to listen. We
Yeah.
all, especially on Zoom, right? Those meetings where we realize we've answered 5 emails in the middle of the meeting. So, but I get, I'm working with these communities who are trying to help youth in foster care have successful lives, and to listen to what it's like for a young person who didn't have a home, who was abused, who had health issues. That's really interesting to listen to another blowhard, in our government, anywhere. Just, it's nonsense. So, yeah, different sources.
Now, well, I guess this has been happening for a while, for decades, but now I feel or I sense that we need to really start listening to nature, to rivers and mountains, to animals, to microbes and bacteria, as you know, we are sharing this existence, and humans have really put that in peril for our lack of epistemological devices to understand them, but also because we don't take the time to listen and to learn from those organic, living, self regenerating processes. How is design integrating this idea of communicating with the non human? And how important is this for the future of the species, I guess?
It's everything, right? I think it's very difficult to generalize about how design is doing one thing or another. I'm the steering committee on the future of design education that I'm on has been interesting and eye-opening, just to remember how many different definitions of design there are and how many different opinions there are about what it is and how we should educate. So there are a whole lot of designers out there who probably don't look out the window. They only look at their computer screen. And designers are people, right? It's what every person needs to be doing. And we're probably too late.
You have, I think, stated that you have always been interested in things of in the environment, but I sense that in the last, I don't know, decades or so, you've been closer to those projects in your work and professional life. How do you see those projects coming into life, but at the same time, well, in the realm of health and wellness, and how that is an important thing for us to understand?
Well, I think the only thing that's going to heal us is if we participate in healing nature. We are nature. There is no, talk about no boundaries, right? There is no boundary between us and nature. And I get more joy from watching a bird than I do most of the other sort of human made things that are in my life. So I think, again, these things you're talking about are bigger than design. They're bigger than any single topic. All we have is this planet, and we've poisoned it, we've heated it. And so I just think, as designers, and particularly as a communication designer, I think one of the things I can do is get other people to care about things, right? Again, not, in at the end of the years I spent in identity and advertising, I thought, you know what? After all this time, I know how to make people want things, right? I learned how to do that. And now I would like to make people want what's good for us, and that is to have a different relationship with the planet than we've had.
Amazing. That's really, really inspiring, and uh, I can't wait to continue, listening and seeing what you do, because I think that many of the crises that we have is a crisis of being, because we've lost this ability to sense ourselves, to sense the others, to sense the planet, to sense the animals, and caring and uh, resacralizing or making sacred again all those things, independently of the methodologies and the design and the engineering, is the healing. The caring is the healing, even if we cannot control all the factors. And at the same time, we won't be able to control all the factors. And those things are greater than us. And that's an amazing principle that I think should be at the forefront. So just to wrap this up, I've been thinking a lot about the interruption. This recording was interrupted by a problem with your Wi-Fi 2 weeks ago, and in a sense, illness and disease are also understood to be interruptions of normality, and then a drug or a medical intervention, a surgery, can help and get us back into the same normality. And this, of course, is what's happening already with the pandemic. And while some want to get back to the normality that we had, many think that normality was not working. My question is, in your consulting experience for big design projects, how have these plans been interrupted, and how social design not only works with interruptions, but knows that interruptions are inevitable? And in a sense, because what we discussed today here, we're also in this interruption of something. and how interruptions must be seen as, I don't want to put words into your mouth. So what about the interruption?
I read somewhere once something I absolutely loved, and it was that not all time is equal. And in a sense, everything we do is interrupted, interrupted by our sleep, interrupted by intentional, I'm going to put this draft down and come back to it in a day because I need that interruption. And so that processing time, I think, is one of the real gifts of those kind of events, right? We don't always know it at the time, but interruptions are times when we should be inactive. The I Ching talks about, do nothing and everything gets done. So those are sometimes unexpected, sometimes unasked for opportunities to reflect. And reflecting is such an enormous part of the creative process.
I love that. We can't be creative if we are not interrupted.
Mm-hmm.
Cheryl, I want to thank you very much for this conversation, and I hope we can continue co-creating things together.
I would love that. Thank you, Victor. And I apologize about the lightning storm, but in the end, and I think, should I try to remember what I wore that day and wear the same thing? But no, we'll be honest.
Yeah, absolutely. And as we said, the interruption is life. So we have to acknowledge it and celebrate it, and thank whatever powers allow us to reconvene and reconnect. Thank you so much.
Thank you, Victor. Bye.
Bye bye.